Welcome to today's informational webinar for the NIH Common Fund's Precision Medicine with AI, Integrating Imaging with Multimodal Data program, also known as PRIMED AI. Today's informational webinar will cover the Logistics Center funding opportunity, which uses the U24 activity code. The full funding opportunity number is RFA-RM-27-015. The due date for this NOFO is October 2nd, 2026. My name is Caitlin Browning, and I'm from the Office of Strategic Coordination, the office that runs the Common Fund. I am on the PRIMED AI program team alongside Dr. Sahana Kuke, also from the Common Fund, Dr. Sangeeta Bhargava from NEI, and Dr. Chris Kandarpa from NIBIB. You will hear from each of us today as we introduce you to the NIH Common Fund and to the PRIMED AI program. You will also hear from Dr. Chi Duan from NIBIB, who will walk you through the funding opportunity, explain eligibility requirements, and provide guidance on the application process.
Thank you for joining us today for this webinar on new funding opportunities in the NIH Common Fund's PRIMED AI program. My name is Sahana Kuke, and I'm the program leader for PRIMED AI. To start, I'd like to take a few minutes to give you some background on the NIH Common Fund, the program office sponsoring this initiative. The NIH Common Fund was established by Congress in 2004. Its mission is to support bold scientific programs that catalyze discovery across all areas of biomedical and behavioral research. What sets the Common Fund apart from other NIH programs is its scope. Rather than focusing on a single disease or organ system, it invests in research that benefits the entire NIH enterprise and the broader scientific community. Common Fund programs are designed to be novel, transformative, catalytic, goal-driven, and synergistic. In practice, that means they tackle important challenges that no single NIH institute, center, or office could address on its own. These are the kinds of problems where a coordinated NIH-wide effort is truly needed to make meaningful progress. A defining feature of the Common Fund is how it brings people together, both scientifically and administratively. On the scientific side, researchers from many different disciplines provide input that informs the design of new programs. The goal is to make sure that program design reflects the real landscape of the science, not just any one perspective. For PRIMED AI, this included a strategic planning workshop held in March 2025, which brought together over 1,000 subject matter experts, community members, and NIH staff to identify high-priority opportunities and challenges in the field. That input directly shaped how the program was designed. After awards are made and the program launches, funded researchers then participate in interdisciplinary research consortia, working across institutions and specialties toward shared goals. On the management side, leadership and staff from across NIH, from individual institutes, centers, and offices, work together to develop funding opportunities and provide oversight throughout the life of each program. This collaborative approach helps ensure that Common Fund programs are well coordinated and that they have broad institutional support across NIH. Currently, the Common Fund supports more than 20 active programs. Each one is designed to change the trajectory of biomedical research, whether by accelerating emerging science, breaking down barriers that have slowed progress, or supporting high-risk, high-reward ideas that might not fit neatly within a traditional funding mechanism. Previous Common Fund programs have made significant contributions across a wide range of areas, from genome editing and human microbiome research to structural biology, pragmatic clinical trials, biomedical research training, and the creation of AI-ready data resources. These programs have generated new knowledge, tools, and resources that continue to benefit researchers and patients long after the programs themselves have concluded. Today, we are here to introduce the newest addition to this portfolio, the Precision Medicine with AI, Integrating Imaging with Multimodal Data program, or PRIMED AI. PRIMED AI was approved by the NIH Council of Councils in April 2025, and it represents the Common Fund's investment in harnessing the power of artificial intelligence to transform how clinical imaging data is used in patient care. In the remainder of this webinar, we will walk you through the program's goals, structure, and the specific funding opportunities that are now available to you as potential applicants. Let's get started.
I'm Chris Kandarpa, the Director of Research Sciences and Strategic Directions at the National Institute of Biomedical Imaging and Bioengineering. As you just heard, the NIH Common Fund aims to accelerate emerging areas in health-related science and technology. Today, nothing is more in the news than artificial intelligence. Concomitantly, the NIH supports advances in precision clinical medicine. The intersection of these two developments provides the rationale for launching this PRIMED AI project. Having said that, the practice of precision medicine requires a holistic integration of all available patient health data. Clinical imaging has and always will play a central and critical role in modern healthcare. Unfortunately, imaging is used in isolation and seldom included as a data element in current AI models for clinical medicine. Fortunately, advancements in data science offer new opportunities to better integrate clinical imaging and conventional non-imaging health data. Importantly, to be successfully accomplished, these developments must be driven by a team of scientists with expertise in various disciplines. And the governance and best practices of these innovations should be driven by the entire community of stakeholders.
PRIMED AI goal is to support the development and adoption of innovative, reliable, and cost-effective AI-based clinical decision support tools that integrate clinical imaging with other health data to improve care across a wide range of conditions. The PRIMED AI initiatives are organized around 4 key topics, as you can see in this diagram on the right-hand side. The first one is imaging and multimodal data integration, that is to improve access to and integration of clinical images with other health data types. AI algorithm and tool development. This is to develop and refine AI-based tools to support diagnosis, management, and prediction. The third is clinical implementation, that is to test PRIMED AI clinical decision support tools to advance precision medicine approaches. And lastly, trust and coordination. And this is to promote program cohesion, adaptability, scientific rigor, validation, and transparency. The scope of PRIMED AI is that clinical imaging includes any FDA-approved imaging modality used in patient care, such as radiology, ophthalmology, endoscopy, laparoscopy, and dermatology. PRIMED AI projects will use clinical imaging as the foundation and combine it with other multimodal health data, including EHR data, labs, omics, and wearables, to address clinical needs and support precision medicine. The expected deliverables. PRIMED AI will produce innovative and reliable AI-based tools, best practices for integrating imaging and multimodal data in precision medicines, and lastly, durable stakeholder relationships to expand and sustain the field.
The PRIMED AI team has developed 4 sub-goals that iterate on the primary goal and scope just described and underpin the project's funding opportunities. These sub-goals are highlighted in yellow: imaging with multimodality data integration to facilitate access to and integration of clinical images and multimodal data. Highlighted in blue, AI algorithm and tool development to develop and iterate on AI-based algorithms and tools to advance clinical diagnosis, management, and prediction. Highlighted in red, clinical implementation to test PRIMED AI clinical decision support tools and catalyze new precision medicine approaches. And finally, highlighted in green, building trust and ensuring coordination with the PRIMED AI ecosystem through coordinated activities to ensure program and community cohesion, adaptability, scientific validation and rigor, and operational transparency. Diving deeper into the description of notices of funding opportunities, but refraining for now from a description of funding mechanisms, the 5 PRIMED AI NOFAs are: 1. Data to models, academic industrial partnership. Phase 1 during the first 2 years will require demonstration of data integration and interoperability. Phase 2, upon successful completion of Phase 1, will require developing models and testing their performance during these final 3 years. 2, translating models to clinic will require rigorous optimization of multimodal AI models for broad clinical use. Phase 1 will require the development of AI tools which may be built utilizing existing databases. Phase 2 will require the evaluation of model utility in the real world. And to ensure trust and coordination, the 3 NOFOs shown in green boxes are playbook to create and codify standardized frameworks for the responsible development and use of PRIMED AI models, including data ontology, technical management of data, error mitigation, and preparation for eventual interaction with regulatory agencies, the Logistics Center to administer the entire program and evaluate its performance, provide teaming support, and engage with stakeholder communities, and finally, the Validation Center, which will function coordinating with the Logistics Center to verify, validate, quantify uncertainty, and promote reproducibility of PRIMED AI tools.
All notice of funding opportunities or NOFOs for PRIMED AI will use cooperative agreement mechanism or will be using U activity code. This means that the NIH staff are highly involved and have scientific or programmatic involvement throughout the project. The NIH's role is to support the awardees' activities through scientific partnership, but not to take on a dominant role. The awardee is responsible for the project's overall direction. Playbook NOFO will use the U01 activity code. This code is used for supporting a discrete, specified, circumscribed project to be performed by the named investigator or investigators in an area representing his or her specific interest and competencies. Data to model and model to clinic NOFOs will use UG3-UH3. The UG3-UH3 cooperative agreement involves 2 phases. The UG3 phase for up to 2 years is designed to support a project with specific milestones to be accomplished by the end of the period. The UH3 phase is to provide funding for up to 3 additional years following successful completion of the UG3. The Logistics Center will use the U24 activity code, which is used for projects that are resource-related research projects. It funds large-scale, multidisciplinary infrastructure projects. The Validation Center will use the U54 activity code, which is a specialized center cooperative agreement. This activity code is used for funding large-scale, multi-component research programs designed to address complex, multidisciplinary biomedical problems. A major emphasis of PRIMED AI NOFOs is team science and scientific collaboration.
This table contains key information for all 5 of the PRIMED AI funding opportunities. Applications for the Playbook U01 opportunity, RFA-RM-27-011, are due on October 9th, 2026. Applications for the Data to Model Academic Industrial Partnerships UG3-UH3 opportunity, RFA-RM-27-012, are due on October 19th, 2026. Applications for the Model to Clinic UG3-UH3 opportunity, RFA-RM-27-013, are due on October 19th, 2026. Applications for the Validation Center U54 opportunity, RFA-RM-27-014, are due on October 2nd, 2026. Applications for the Logistics Center U24 opportunity, RFA-RM-27-015, are due on October 2nd, 2026. All applications are due by 5 p.m. local time of the applicant institution. Learn more about these funding opportunities at commonfund.nih.gov/primed-AI.
Hi everyone, my name is Qi Duan. I'm a program director of National Institute of Biomedical Imaging and Bioengineering. Today, on behalf of National Institute of Health's Common Fund Prime AI initiative, I'm presenting the novel on Logistics Center. The purpose of the novel is to create a logistics center for the Prime AI program that provides the consortium's administrative infrastructure through 3 integrated cores and provides teaming effort, engage the stakeholders and communities, and coordinate program activities. The Logistics Center is to facilitate and coordinate Prime AI activities to maximize impact for the Prime AI community. It has 3 integrated cores, which are administration, evaluation, and outreach. The center works closely with other Prime AI consortium members to collect, curate, and disseminate information regarding the tools developed by the Prime AI award recipients. The center should facilitate widespread access and awareness across the relevant scientific, patient, and clinical communities. The budget of the first year is limited to $575,000 direct cost. For year 2 to year 5, the budget limit is up to $2.5 million direct cost per year. The project period should be determined by the scope of the proposed project, and the maximum project period is 5 years. Let's now go over some key requirements. For that administrative core, it should provide logistical and administrative assistance in arranging Prime AI steering committee and other meetings. The core should be developing policy, SOP, and other documents for the consortium. They also need to coordinate effort with the validation center and also managing the sub-projects. In year 2 to year 5, the core should also develop teaming projects for the consortium members and develop innovative curricula and outreach activities. The administrative core is in charge of the external advisory board and providing administrative support, and is responsible to report to NIH staff. For evaluation core, they should develop and manage an external advisory group to provide feedback on multimodal AI clinical decision support tools and resources developed by the consortium. It is responsible to timely report to NIH staff on activities and progress, and is also in charge of record keeping and reporting. The outreach core should develop consortium-wide web portal for data and resource sharing infrastructure. The core is also responsible to promote consortium resources through social media, scientific meetings, publications, and etc. The outreach core should engage external stakeholders to identify research gaps and opportunities and establish a community review board. The review criteria is following standard U24 review criteria, plus the following additional consideration: the effectiveness of the proposed coordination plan, track record in relevant areas, plan to support novel AI clinical decision support development and novel strategies, approach to manage complex consortium, and approach to key components like external advisory group, web portal, and outreach. Thank you for your attention. For questions, please contact odprimed-ai at od.nih.gov.
Thank you for joining us today for this informational webinar. The PRIMED AI program team plans to host live question and answer sessions in the coming weeks. Details for these events will be posted to our website, commonfund.nih.gov/primed-AI, and distributed through the listserv. If you'd like to subscribe to the listserv, go to go.nih.gov/Z6E8R. View recorded webinars of the other PRIMED AI funding opportunities at commonfund.nih.gov/primed-AI/webinar. Find answers to frequently asked questions at commonfund.nih.gov/primed-AI/FAQs. Lastly, feel free to contact us with any questions at odprimed-ai@od.nih.gov, where we will match you with the appropriate scientific expertise. Thank you for your attention and for your interest in PRIMED AI.